watching ABC-7 Eyewitness News.
How do you look your best while stopping the signs of aging, or at least slowing them down? We'll learn a few options for aging gracefully from a Chicago plastic surgeon. That's coming up.
So nowadays you have more options than ever to slow down the aging process, or at least try. But which products or procedures really do work? Which ones fall flat? And there is the question of whether or not to do it at all. So here to give us a few suggestions for looking our best is plastic surgeon Dr. Lawrence Iteld. He joins us this morning to kind of give us an idea. So let me just start by saying this. There's some women out there who are like, absolutely, I want to do everything. And there's some women out there who are like, you know what? This is just natural. It's part of the process. I'm going to age without doing anything at all. So what do you say to both groups?
Well, I think the key is tailoring the treatment to whatever each woman or each gentleman wants. And for people who really are hesitant at first or don't want to do things, basic skincare. Sunscreen is the foundation of preventing aging. We can't change our genetics, but we can certainly change what we do. Beyond the sunscreen, the next steps would be some of the injectable treatments, and the king is Botox. And we've been talking about that for years. And when it's done right, it gives you a fresh look, a rejuvenated look, but not an overdone look. And then we can go even further than that. And for people who are ready, who need injectable treatments for volume in their cheeks, we have lots of options. And then, of course, even the surgical options.
What are some of the concerns people should have? Because I'm sure there are a lot of folks who go, obviously hesitant. I am paranoid of needles, so it's not even something that I would want to consider because I'm that afraid. So there are folks out there like that too. What would you say to them?
Well, what most of our patients have said is that this is really easy. And yeah, they're needles, but they're really small needles that we use. And probably the best analogy I had is it's easier than having your eyebrows waxed, and it hurts less. And so the first time could be a little scary for some people, but after that they come in and we just have fun and they relax, and it's an easy process.
So on the front, plastic surgery front, obviously that's what you do. Do you see that as the #1 thing that people are doing right now, Botox, or are there other things that are starting to pop up that we may not have heard of at this point?
Well, the king is still Botox, and in this country we're seeing almost 4 million treatments a year with Botox, and then the next most common would be the injectables, the Juvederm, the Voluma, Restylane. Those are about 1.7 million. But the new kid, which is really exciting, is something called Kybella, is just FDA approved a couple of months ago, and this is a medication that dissolves fat when we inject it, and so we're really excited to be offering it. And the first area that we're looking at is in the neck and the double chin, and it's a non-surgical option that we can do in the office. It just takes a few minutes. Most people will do 2 to 4 treatments, but if you can do that with minimal downtime, it's a really exciting way, again, to help you look fresh.
All right, some interesting stuff there. Thank you very much for that, Doctor. And of course, we're going to have more information about all this on our website, abc7chicago.com. We'll be right back after a short break.